that one, and magically we are on the air this morning, and we're on the air with an interesting guest. This is going to be a fascinating conversation for me, talking to Dr. Sonya Reddy. She's in Dallas, Texas. She is a dentist, and she's going to tell us about this study that finds a link between gum disease and a certain oral bacteria and perhaps Alzheimer's or other conditions that you might come down with, dementia-type conditions in the brain. And our conversation brought to you by Marcus & Mack, a law firm representing injured people. Dr. Reddy, good morning.
Good morning. Thank you for having me.
It's great to have you on the air with us here today. We had a poll. Our poll question each week is always different and covers different topics. 2 weeks ago, it was about dental care. And the question was basically, how often do you go to see the dentist for a checkup? And I think it was 79% of the people go once a year and have been to the dentist within the last year. And I think a good bit of them, 65%, had been there in the last 6 months. We're doing pretty good, aren't we?
I love that because COVID had to put a damper on it, and we didn't see patients for 2 years at a time. So this is great.
Yeah, well, we had about 6% of people said they'd never been to the dentist, so we've got to deal with stuff like that too. And from what we're reading in this study that we cite here this morning, more than just for the condition of our teeth, and I know that you've been in this business for long enough that you know that there are connections between overall health and dental health, aren't there?
Correct. Oral health leads to overall health. And this is all part of like your severe generalized inflammation, right? Any bacteria that's in the mouth that's causing bleeding and bone loss and whatnot can also affect other parts of the body because it can travel through the bloodstream and cause type 2 diabetes-like symptoms and heart attack. There was a cardiologist talked about this for many years now, how having inflammation in the mouth and these kind of bacteria, Fusobacterium nucleatum is the one that's in the study now, but we also know there's 4 or 5 other bacteria that can cause havoc in the whole body because it increases your inflammation, and chronic inflammation leads to disease. We all know that.
And that makes perfect sense when we think about that, but that's probably not somebody who isn't in the field as you are, they think about. So the question becomes, how do you spot that, and who best is there to spot it? And obviously the answer is the dentist can help you figure that out.
Yes, dentists can help you figure that out, but also as an individual, I'm a huge proponent of you have to take your health into your hands because we have the health care here is sick care, so we want to prevent from getting into sick care. So if you have bleeding gums and if you have halitosis and if you see deposit on your teeth, this is not normal. So go and seek a specialist especially for the 6% you were talking about that never been to the dentist. At least if they look in the mirror and figure out, oh my God, my teeth are bleeding every time I brush my teeth. So, but I have patients that have come into my office. They're completely unaware of the disease or the bleeding, and they've even said they've stopped brushing because my gums started bleeding. So I think it's very important for you guys to do, radio stations, TV stations to really cover, dentist has always been seen as, somebody that will drill and fill, put a cavity in there, but never seen as part of the medical profession. And I think this is coming about more and more it's about the oral disease leading to other things and inflammation. So your dentist is definitely good at helping you prevent it. In our office, we do cutting-edge stuff, and we just started recently. We take a swab of your saliva if we think there's early signs of gum disease, and we put it under the microscope, and we show it to our patients, and we talk about stuff we can do to treat it.
Mm-hmm. I'm guessing. I'm guessing that as you have gone through your dental career and your educational process as well, that some of the connections between other diseases and gum disease and bleeding gums weren't surprises to you. Did it surprise you about this Alzheimer's connection?
I think I knew there's a part of a chronic inflammation, but it didn't shock me at all because we knew there's other aspects of the body that there was not enough research was done. We knew about the heart disease. We knew about the low birth weight in children, if it gets in, pregnant women. But I think the most shocking thing for patients that I've seen is if a person in the household does not believe in dental treatment, and if he can transfer that bacteria, specifically the Fusobacterium nucleatum, to his pregnant wife or to his kids and cause, inflammation in their body as well. So it is transferable. And I think when that research came about, it was shocking. But I think the more and more research has been happening in this field where they're making dental as a part of the medical profession and understanding that there's, aspects that I think more and more will come out and what we want to see to bring out awareness in patients to help them.
Wow, that's a whole new dimension to this entire story here. The fact that somebody who isn't taking care of themselves dentally can pass those bacteria on to other members of their family. That's something that we hadn't considered at all. So what should people be doing right now?
I think people should be asking for cutting edge, like going to the dentist and asking for a swab test, taking care of their health. Do the basics consistently, which is, the rule of two, brush twice daily for 2 minutes, and also go to the dentist at least twice a year, if not more. 47% of Americans have gum disease, and those people need to go to the dentist at least every 3 months to control this bacteria. So, call your dentist.
Is soreness of the gums or bleeding of the gums, are those the signs that we should, obviously we should be looking for those signs and know that something's wrong there? Are there other indicators?
I think as a patient or as a person when you're doing, other indicators would be bad breath. They see that, and then there could be some systemic diseases that are affected by it because, if someone has type 2 diabetes and they're not able to control it, or hypothyroidism and they're not able to control it with medication, you have to look at the outside of it. Like, what is this, being caused? Is it the inflammation in the body, and where is this coming from? If you have severe gum disease, they're known to not be able to control their diabetes with medications and exercise.
Most people, I believe, say the only reason I need to go to the dentist is to find out if there's a hole, if there's a cavity,
exactly.
If there's a cavity, or if they're shiny and white enough. But there's much more to it than that, isn't there?
Absolutely, and it's not uncommon. There's so many patients that come in for teeth whitening, and we find this whole like gum disease, and they're shocked at best. And I think there is this disbelief in their eyes. Like, really? Is it the gum disease, and that's why you don't want to do my whitening? And so we talk about the cosmetic, and I'm a cosmetic dentist, so I do a lot of cosmetics, but I do believe in health and function first. Yeah.
So all of those are a part of this entire mix of your overall health picture. It really does become a part of your overall health picture. The survey that we have this week, we took that dental survey that we did, and they said, well, okay, what about your yearly checkup with your primary care physician? We're finding that people here are doing very, very well with that as well. So that's a great thing. But dental care is a part of the overall health, and I think sometimes people might get a little bit surprised when they see the doctor checking things like, okay, lift up your tongue. I want to see what's underneath your tongue. When they're feeling around your jawline and trying to find things there to see if there's anything there. That it's really a picture of your overall health.
Absolutely. And I think people, like you said before, people think dentist is related to teeth only, but we forget there's soft tissues attached, and there is bone that is attached to the tooth, and we look at the health of, all of that stuff, and it all tells a story.
Yeah. All of it does, and so it is really incumbent upon us to take good care of our teeth and of our dental health overall. Okay, Dr. Sonya Reddy, where are we going to find out more? What's the best resource for us?
SmileUpDentistry.com. I'm also on Instagram, Dr. Sonya Reddy, and we talk about all of these topics to improve awareness for overall health.
Well, beautiful. We thank you for being with us here. I'm assuming you have a wonderful smile.
Thank you. I do.
Have yourself a wonderful day today. We appreciate your time.
Take care. Bye.
Bye-bye.
Bye.
Bye-bye.